Community Regional Medical Center is the only hospital in the valley that can treat brain aneurysms and strokes by removing blood clots from the brain. When Pablita Garcia experienced a brain aneurysm 7 years ago, it was her quick decision to get help and the doctors there that saved her life.
I had a headache, this massive headache, and I just felt awful. So I decided I was going to go home, and on the way home, it was even worse.
One of Pablita's physicians, Dr. R. Locke McDonald, says she had a brain aneurysm that ruptured.
A brain aneurysm is a weak spot on a blood vessel that's obviously in the brain. And so if you imagine, for example, in your the sprinkler system in your yard, if the hose gets a weak spot and then it bulges out, that would be like an aneurysm. And then, of course, what happens if it ruptures? You have a brain hemorrhage, and that actually is called a subarachnoid hemorrhage. People who have a ruptured aneurysm, there's a very classical set of symptoms that happens. And basically, it's if you have a sudden onset of a severe headache, generally the worst headache you've ever had in your life.
It hurt so bad she typed 911 in her phone, and when she pulled into her driveway near Bass Lake, she called. That's the last thing she remembers. She was rushed to a hospital, but needed to be transferred to Community Regional, the Valley's first certified primary stroke center. There she met Dr. Amar Khan, an endovascular neurologist and the co-director of the stroke program.
When I met her, she was very confused, and we were able, fortunately, to take her to the operating room and treat her ruptured aneurysm, and she ended up having an excellent outcome.
Dr. Khan performed a cerebral or brain angiogram, going into the arteries of Pablita's brain to see exactly where the aneurysm was.
We ended up treating the aneurysm by a process called coil occlusion, which is to say that we implant these platinum filaments that go into the inside of the aneurysm to shut off flow and to keep it from bleeding again.
Dr. Khan also found 3 other aneurysms in Pablita's brain and was able to treat those.
Very grateful, and very grateful for Dr. Khan as well. I didn't realize at the time that Community Regional was that vital to the area, because I'd never really been there, to be honest with you. I would tell anybody to go there now.
Pablita's doctors say the fact that she acted fast in getting help played a huge role in her recovery and outcome.
The most important thing that determines how the person is going to recover is what their condition is when they come in. And so that's why it's important, if you just have a headache and it's a ruptured aneurysm, that you go to the hospital right away and we fix it before you deteriorate.
The fact that she came in early allowed us to give her treatment to prevent further complications that could happen even in the early phase.
Pablita shares her advice.
If you have something that is the worst headache you've ever, if you feel anything that's just beyond normal, go to the hospital.
Dr. Khan provided Pablita some reassurance about her future.
Well, I'm happy to say her prognosis is excellent. Statistically, we know that people who've had one ruptured aneurysm are at risk of another ruptured aneurysm. However, in Pablita's case, we were able to identify those other aneurysms and treat them.
Dr. Khan did a series of imaging to continue following Pablita's arteries for more than 7 years now, all of which didn't show any other areas of concern.
Aneurysms can have a familial or family inherited component to them. It is important that if someone has a family history of someone very close to them who's had a brain aneurysm, and when I say close, I mean either parents, children, or siblings, they may be at an increased risk of this happening.
Risk factors for a brain aneurysm include smoking and high blood pressure, but things in your medical history can also play a role, including family history. Pablita's father died of a stroke, and doctors say it's important you are aware of your family history of stroke or aneurysms.